Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Herniated cervical discs, and I have had a 2-level disc removal and spinal fusion at C4-5 and 5-6. But I've had quite a loss of range of motion. I think especially tilting to the right and to the left. I have less range of motion looking all the way to the left or right.
It's more actually,
Yeah.
You have more limitation on.
I have more limitation looking right, yes.
On looking to the right.
Yeah.
Okay.
And also looking up. I just feel like I can't hardly look up at all.
So when did you have the surgery?
1994.
94. And since then you've been having those limitations or get worse over time?
I certainly had limitation from then, or probably even before the surgery. It may be getting a little bit worse.
A little bit worse.
And I do have on the more recent MRIs other bulging discs above and below.
Above and below, that's typical. Okay. So have you had any treatment for your neck? What did you do for your neck?
Okay, so I ended up having a minimally invasive spinal decompression on the next level down.
Okay.
6, 7.
Okay. What about treatment, like any physical therapy or anything?
Just post-op physical therapy.
Post-op. And did you notice your range of motion improved or was just subtle?
Actually, I would have to say that all of the traditional post-op or all the physical therapy I've had has never increased my range of motion.
Okay.
It would make my muscles get
looser,
less spasm.
Spasm. Okay. So our goal is to get you range of motion.
Yeah.
Let me see your range of motion again. Rotate to the left and right. So that's tight here. Okay. Not too bad this way. Extension, flexion. That's really tight there. Okay. And side bend left and right. And when you do that, how much pain do you feel at worst?
It just feels like it's stretched to the limit rather than that pain.
Pain, just something.
I mean,
blocking.
it starts to feel uncomfortable. But it's not.
But it's all tightness.
Yes.
And where do you feel the worst area of tightness?
I would say it feels the worst looking to my right and looking up.
And where do you feel it in the back?
Oh.
Let me know if you feel any discomfort, okay? You feel all this tightness here?
Yeah, it feels like it's tight when you're pressing on it.
Yeah. Make sure it's pain-free, okay? So we're gonna do the same thing, just gonna do few release, and we'll check your range of motion. And after that, doing release and testing, and see how far we can go. No, that's painful.
Because it does feel tight on the lower cervical.
Right. So after the treatment, just the first treatment, let's see how you feel. How's your range of
motion?
motion?
More. Now I'm looking at that picture a little bit.
Okay, I think that's a full range of motion on that side.
Oh yeah, this one I can now kind of see back to that door.
Yeah, that's awesome.
So that's gone.
Okay, that's because the fusion. Let's look. Okay. How's that?
It's certainly better, I think, than before.
The first time.
Yeah.
Compared to the first time.
This one is still more limited to me.
Okay. What about flexion forward?
This one I never felt that I had a real problem.
Yeah, this is okay.
Yeah.
It's not too bad. Yeah, so you get more on the left and
definitely
right, definitely on that. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.